Stick out your tongue right now, not at someone, just out, flat, relaxed, in front of a mirror if you have one nearby, or just out in front of you where you can see it. Look at it carefully. What color is it? Pink, pale, slightly yellow toward the back? Is there a white coating sitting on the surface, thin like frost, or thick like paste? Are the edges smooth, or do you see scalloped indentations pressed into the sides? Little curved dents that look like your teeth have been leaving marks while you sleep? Is the surface smooth and glossy in patches, areas where the texture seems to have disappeared entirely? Or is it cracked down the center, a fissure running from tip to back like dry earth in a drought? Most people have never looked at their tongue this carefully in their life. And most people have no idea that what they are looking at right now, in 30 seconds, with no equipment, no blood test, no appointment, is one of the most information-dense diagnostic surfaces in the human body. Your tongue has been trying to tell you something for months, possibly years, and every time you opened your mouth at a doctor's appointment, that doctor looked at your throat, maybe pressed your tongue down with a depressor, said everything looks fine, and moved on, because what I am about to show you is not part of a standard Western medical examination. It is not taught in most medical schools in this country. It will not appear on your annual wellness checklist. But it is real, it is documented, and once I show you these 7 signs, you will never look at your tongue the same way again. Stay with me through all 7, because sign number 4 is the one most people over 60 have right now and have never once connected to what is happening in their body. Subscribe to Dr. Huang right now. This channel exists to give you the physical examination your 12-minute appointment skipped. Hit subscribe and let's continue. Here is what happens at a standard doctor's appointment when you are over 60. You describe your symptoms: fatigue, bloating, brain fog, joints that ache in ways that are hard to explain, a digestion that has been unreliable for years, sleep that never quite restores you. Your doctor listens, orders blood work. The blood work comes back mostly normal. A few numbers at the edges of the range, nothing flagged as critical. You are told everything looks fine. Come back in a year. You leave with no explanation and no direction. And the symptoms continue. What if I told you that for hundreds of years, in medical traditions that predate modern blood panels by 2,000 years, physicians were trained to read exactly those symptoms from a single surface that required no laboratory, no machine, no insurance approval, the tongue? Not as mysticism, not as guesswork, as systematic clinical observation, a skill that takes years to develop at its highest level, but whose 7 most important signs are visible to any person with 2 eyes and 30 seconds. Your tongue is a direct window into your internal environment. It is the only internal organ you can see from outside the body. Its color reflects the state of your circulation and organ blood flow. Its coating reflects the state of your digestive system. Its shape reflects fluid balance and the stress load on your heart and kidneys. Its texture reflects the state of your nutritional reserves. Every one of those things can change, and your tongue will show you the change before a blood test catches it, before a symptom becomes a diagnosis, before a condition becomes a crisis. Let me show you the 7 signs. Before we go through the signs, I need to be clear about something. What I am about to describe is observational information. It is a tool for awareness, not a replacement for clinical diagnosis. If you notice a white patch on your tongue that is raised, cannot be wiped off, and has been there for more than 2 weeks, that needs to be seen by a doctor this week. That can indicate a condition called leukoplakia, which requires evaluation. If you notice a red, smooth, painful patch that appeared suddenly, or any sore on your tongue that has not healed in 3 weeks, see a doctor. Oral changes that persist need professional examination. If your tongue is severely swollen, causing difficulty swallowing or breathing, that is an emergency. Stop this video. Everything I'm about to describe refers to gradual chronic changes that have developed over months or years. These are the quiet signals, the slow messages, the ones your body has been sending without urgency, which is exactly why they get missed. Sign 1, a pale, washed-out tongue. What it means: your blood is not delivering enough oxygen to your tissues. Take your tongue out again and look at the color. A healthy tongue is pink, not red, not white, a warm, even pink across the entire surface. If your tongue is pale, noticeably lighter than that warm pink, almost whitish, or the color of the inside of your lip pressed flat, That paleness is telling you something about your blood. Specifically, it is telling you that either your red blood cell count is low, your hemoglobin is reduced, or your circulation to peripheral tissues has become sluggish. All three of those conditions produce the same result on the tongue. The small blood vessels in the tongue's surface tissue, capillaries so fine they carry cells in single file, are carrying less oxygenated blood than they should. The color fades. The tongue looks washed. After 60, this pattern most commonly points to one of three things: iron deficiency anemia. Not dramatic, not crisis level, but the quiet, grinding kind that builds over years of inadequate absorption. After 60, stomach acid production declines, and iron absorption depends heavily on stomach acid. You may be eating adequate iron. Your gut may not be absorbing it. B12 deficiency. Again, an absorption problem more than a dietary one. B12 requires a protein called intrinsic factor, produced in the stomach lining, to be absorbed. Stomach lining integrity declines after 60. Many people over 60 are functionally B12 deficient with serum levels that appear borderline normal on a standard panel. Or reduced cardiac output, the heart pumping with slightly less force than it once did, meaning peripheral tissues receive less blood per minute. The tongue, being highly vascular, reflects this immediately. A pale tongue is not a diagnosis. It is a question. And the question is my blood delivering what my body needs? Sign 2. A thick white or yellow coating. What it means: your digestive system is under serious strain. Now look at the surface coating. A thin, white, slightly moist coating on the tongue is completely normal. It is a thin biofilm of bacteria, dead cells, and saliva proteins, the natural resident layer of a healthy mouth. What is not normal is a coating that is thick, pasty, that sits on the tongue like a layer that was painted on, that is yellow toward the back of the tongue, that has an odor even after brushing, that was not there 10 years ago. That coating is a map of your gut. The tongue and the digestive tract are connected by the same embryological tissue. They develop from the same structure in the womb and maintain a biological relationship throughout life. The state of the gut lining, the population of gut bacteria, the efficiency of digestion, all of it expresses itself on the tongue surface. A thick white coating most commonly indicates one of two things. The first is gut bacterial overgrowth. When the balance of bacteria in the small intestine shifts, more pathogenic bacteria, fewer beneficial ones, byproducts of their metabolism migrate upward through the digestive tract and deposit on the tongue surface. This is the physical residue of a microbiome under stress. The second is poor gastric emptying. When the stomach moves food downward too slowly, a condition called gastroparesis that is far more common after 60 than most people realize. Food sits in the stomach longer than it should, ferments slightly, and the fermentation byproducts produce exactly the thick, often yellow-tinted coating you see on the back of the tongue. Here is the clinical tell. Run your finger across the coating. If it smears slightly and smells, that is fermentation, that is food that did not move when it should have moved. And the question is not about breath. The question is about what is happening to every meal you eat before it reaches your small intestine. Sign 3. Scalloped edges. What it means: your body is holding too much fluid, and your heart or kidneys are working harder than they should. Look at the sides of your tongue now. The edges, are they smooth, or do you see indentations? Little curved scallops pressed into both sides, following the shape of your teeth. Those scallops mean your tongue has been pressing against your teeth, and a tongue presses against its teeth for one reason only: it is swollen. Not visibly, dramatically swollen. You are not going to look in the mirror and think my tongue is swollen, but subtly enlarged, slightly thicker than its resting dimensions, pushing gently but consistently against the dental arch on both sides. And a tongue swells for the same reason ankles swell, the same reason fingers are puffy in the morning, the same reason face looks slightly different in the mirror after a salty dinner. Fluid retention. After 60, the two organs responsible for fluid regulation, the heart and the kidneys, lose efficiency in the ways we have discussed in previous videos. When either system is under strain, the body retains more fluid than it should. That fluid distributes through all soft tissues. The tongue, being entirely soft tissue with no rigid structure, swells measurably, and the scalloped edges are the evidence. Here is what makes this sign particularly important. Scalloped tongue edges appear before ankle swelling becomes obvious. They appear before blood pressure shows consistent elevation. They appear when the fluid dysregulation is still mild, still reversible, still in the window where a dietary and lifestyle intervention can change the trajectory without medication. If you have scalloped edges, your body is telling you the fluid management system is working harder than it should. Pay attention now before the message gets louder. Sign 4. A geographic tongue. What it means: your immune system is dysregulated and your gut lining is under attack. This is the sign most people over 60 have and have never connected to anything. Look at your tongue surface. Do you see patches, irregular areas where the normal textured surface seems to have disappeared? Smooth, slightly reddish or brighter pink patches surrounded by slightly raised white borders, patches that seem to change shape or location from one week to the next. That pattern is called geographic tongue, named because the patches look like irregular continents on a map. Most people who have been told about it were told, completely harmless, cosmetic variation, nothing to worry about. That dismissal is, at best, incomplete. Geographic tongue is an immune-mediated condition. The patches are areas where the papillae, the tiny projections covering the tongue surface, have been shed by immune activity. The immune system is attacking and stripping the surface of your tongue. Now, why would your immune system attack your tongue? In the majority of cases, the answer connects directly to the gut. When the intestinal lining becomes permeable, a condition colloquially known as leaky gut, and more precisely called intestinal hyperpermeability, proteins from incompletely digested food pass through the gut wall into the bloodstream. The immune system encounters those proteins, does not recognize them as safe, and mounts a response. That immune response is systemic. It does not stay in the gut. It activates inflammatory pathways throughout the body, including on the surface of the tongue. Geographic tongue in a person over 60 is frequently associated with gluten sensitivity, undiagnosed celiac disease, and dairy protein reactivity, none of which require a dramatic acute reaction to cause chronic immune activation. The immune system can be quietly, persistently activated by a food it does not tolerate for years without producing obvious digestive symptoms, while the tongue maps every episode in shifting continents of lost tissue. If you have geographic tongue, the question is not what is wrong with your tongue. The question is what is your immune system reacting to in your gut? Sign 5. A deep center crack. What it means: your digestive fire has been low for a long time. Look at the center of your tongue from tip to back. Is there a crack? A fissure running down the midline, shallow or deep, continuous or interrupted? A fissured tongue, particularly a deep central crack, is one of the oldest documented tongue signs in clinical medicine. It appears in a body that has been running a digestive deficit for an extended period. Here is the mechanism in plain language. Your stomach lining produces acid, enzymes, and mucus. After 60, all three of these outputs decline. Stomach acid production drops by as much as 40% in some people. Enzyme output from the pancreas decreases. The mucus layer protecting the stomach wall thins. The result is incomplete digestion. Food leaves the stomach partially broken down. The small intestine receives a poorly processed substrate. Nutrients are extracted inefficiently. The body is fed technically, but nourished inadequately. This chronic undernourishment, not starvation, not dramatic deficiency, but the sustained low-level failure to extract full nutrition from adequate food, expresses itself in the tongue's surface integrity. The crack is a drying, a losing of moisture and suppleness in the tongue tissue itself. It mirrors what is happening in the gut lining. Tissue that should be moist, flexible, and regenerating is instead becoming dry, rigid, and slow to repair. A shallow fissure that has appeared in the last year suggests an early digestive decline, addressable with dietary changes and digestive support. A deep crack that has been there for a decade suggests a longer-standing pattern that needs more sustained attention. Sign 6. A bright red or strawberry red tongue. What it means: you have a serious nutrient deficiency that is affecting your nervous system. Look at the color again, but this time look for the opposite of sign 1. Not pale, bright. A vivid, almost inflamed red, particularly at the tip and edges, sometimes the entire tongue surface, sometimes with the normal papillae texture absent, giving the tongue a smooth, almost glazed appearance alongside the redness. That color combination, bright red plus smooth surface, is one of the most specific nutritional signs that exists. It points to B vitamin deficiency, specifically B12, folate, or B3, niacin. The cells of the tongue surface are among the fastest dividing cells in the human body. They turn over completely every few days. Fast cell division requires B vitamins as cofactors at every step. When B vitamins are insufficient, tongue cell renewal fails. The papillae, those small projections that give the tongue texture, atrophy and disappear. The underlying tissue, which is richly supplied with blood, becomes visible, red, smooth, glossy. This is called atrophic glossitis. And while it is named as a tongue condition, what it is actually reporting is a deficiency state that is simultaneously affecting your nerve cells, which also divide rapidly and depend on the same B vitamins. The person with a bright red, smooth tongue after 60 is frequently also experiencing tingling in the hands and feet, mild memory lapses, difficulty concentrating, and mood changes that they have been attributing to aging. It is not aging, it is B12 and folate running low in a body that is no longer absorbing them the way it once did, and the tongue told you before the nerve symptoms became undeniable. Sign 7. A purple or bluish tinge. What it means: your circulation is compromised and your heart or lungs are under strain. This is the most serious sign on this list, and I want you to look carefully, not at the top surface of the tongue, but underneath. Lift your tongue and look at the underside, or look at the very edges and tip in good light. Is there any purple, any bluish cast to the tissue that is not simply the shadow of the tongue's underside? A dusky tint, not bright pink, not red, but somewhere between red and blue? That color is called cyanosis, and it means that the blood circulating in your tongue's surface capillaries is carrying less oxygen than it should. Oxygenated blood is bright red. Deoxygenated blood is dark with a blue-purple tint. When that tint is visible through the surface tissue of the tongue, the capillaries are running with blood that has not been adequately oxygenated. This happens for two reasons. The lungs are not fully oxygenating the blood, meaning pulmonary function is reduced, whether from early chronic obstructive changes, reduced lung elasticity after 60, or poor breathing habits that have developed over decades. Or the heart is not pumping efficiently enough to push oxygenated blood fully into peripheral circulation, meaning the tongue, the fingertips, and the lips are receiving the end of a delivery chain that has lost pressure. A purple-tinged tongue after 60 is not a cosmetic observation. It is a circulatory signal. It belongs on a list of things your doctor needs to know about at your next appointment, not your next annual checkup, your next appointment. Let me tell you about someone I will call Constance, 68 years old, former bookkeeper, meticulous, careful, the kind of person who kept records of everything, including, as it turned out, a small notebook where she had been writing down her symptoms for 4 years. She brought the notebook to my office. The list included fatigue that worsened after 60, bloating after almost every meal, tingling in her left hand that came and went, brain fog that made numbers harder than they used to be, and, written in the margin with a question mark, tongue looks different. Patches. Not sure if this matters. She had mentioned the tongue to one previous doctor who had said geographic tongue, nothing to worry about. The tingling had been attributed to a pinched nerve, the fatigue to age, the bloating to stress. Nobody had put the list together. When I asked her to show me her tongue, I saw 4 of the 7 signs simultaneously: geographic patches, scalloped edges, a central crack, and a slightly pale overall color. That combination told a story. Immune activation connected to gut permeability, fluid dysregulation suggesting kidney strain, long-standing digestive insufficiency, and a blood picture consistent with impaired B12 absorption. She had been to 4 doctors in 4 years with a notebook full of connected symptoms and had received 4 separate, unconnected answers, none of which addressed the common thread. The common thread was her gut, a gut lining that had been permeable for years, producing systemic immune activation, impaired nutrient absorption, fluid dysregulation, and nerve symptoms, all of it written, clearly and precisely, on the surface of her tongue. We ran a comprehensive gut panel, full micronutrient testing including active B12 and folate, and a kidney function panel. Every hypothesis the tongue had suggested was confirmed. Constance looked at me after we reviewed the results and said something I have never forgotten. I showed them my tongue for 4 years. Nobody looked. Here is what you do right now. Tonight, no appointment needed. 1. Go to a mirror with good light, bathroom light, phone flashlight, whatever gives you the clearest view. Stick your tongue out fully, flat and relaxed. Look at the color, the coating, the edges, the surface texture, the center line and the tip. Then lift the tongue and look underneath. Write down what you see. Not a diagnosis, observations, color, coating thickness, edge shape, any cracks, any patches, any unusual color at tip or underside. 2. Compare what you see to the 7 signs in this video. Do any match? More than one? Write those down too. 3. If you see scalloped edges plus pale color plus fatigue, ask your doctor for a full blood count, B12 active level, ferritin, and kidney function panel at your next appointment. Show them your notes. Use the words from this video if you need to. 4. If you see a thick coating, particularly yellow at the back, look at your last 2 weeks of eating. Where is the hidden processed food? Where is the food that sits heavy? Reduce it for 14 days and look at your tongue again. The coating will change before your digestion consciously changes. The tongue reports fast. 5. Starting tomorrow morning, after brushing your teeth, clean your tongue. Not scrape aggressively, clean. A tongue scraper pulled gently from back to front, 5 strokes. This is not cosmetic. Removing the coating residue daily allows you to see changes in the underlying tissue more clearly and removes the bacterial biofilm that would otherwise be swallowed with your morning saliva. How old are you? Write it in the comments right now and tell me, which of the 7 signs did you see? Write the number in the comments. Number 2, number 4, number 6. I want to know what this audience is carrying, because the distribution of those numbers will shape exactly what I cover next on this channel. If someone you love has been dismissed at appointment after appointment, handed partial answers, told everything looks fine while they continue to feel that something is not fine, send them this video. The examination nobody gave them may have been available every single morning in the mirror above their bathroom sink. Your tongue is not decoration. It is not incidental. It is the only internal organ you can see from the outside, and it has been talking to you every single morning for 60, 70 years. It is time to start listening.